Hello, everybody. I'm a little late today. Today's our June roundtable, and welcome to the team.
Yeah.
So today we've got Sarah here that's actually showing her face today. So I'm going to start with Ronnie. Go ahead and introduce yourself.
Hello, I'm Ronnie. I'm doctor's assistant here. I do a lot of different things. It's finally sunny outside, and I'm just,
doing our thing.
About skin, yeah.
I'm Derek. I am the director of the Kalini Laser Clinic, and I take care of all things skin in this building for us.
Absolutely, absolutely. And I hope you know me. I'm Susan Kalini, so I just do what everybody doesn't want to do. Everything that everybody doesn't want to do, all the dirty stuff. And to my left, your right, is Sarah, who is our manager of Age of Innocence. So Sarah, say a few things.
Yep, I help manage upstairs, and I also help with inventory and ordering things for upstairs, downstairs, and marketing.
She's our social media
bit of everything too. Yes.
I've spoken with her on the phone as well.
That's right.
Yeah.
That's right. So today our topic is, because it is June's month, it is acne awareness.
Yeah.
So we always try to tie our roundtable themes into anything that's going on in the social media buzz, and I don't know who named it Acne Awareness Month, but somebody did. I always want to know who those people are behind the scenes in the Hallmark world. How we get a new
name
thing.
for everything.
That's right. A celebratory date for each everything.
And next Wednesday is National OR Timeout Day, so we got a lot of things going on.
Yeah, National OR Timeout Day.
Yeah.
There we go.
Yeah.
So we'll have to celebrate that too.
Yeah.
We're not going to do we do that more of in a medical
We
kind
do,
of environment. So
one of the days.
that's right. That's right. So again, we're going to start out with acne because
Plagues many people.
it plagues many people.
Absolutely.
So Derek, I'm going to let you, since you do everything skin, and you take over this.
Absolutely.
Just go to town.
So, acne is probably one of the most emotional things that I would say that we treat in this office. And we actually just recently had somebody that we treated that just told us she cried tears when she woke up after having one of our acne treatments, because for the first time in probably since her teen years, she's seeing some clearance in her skin, which is always something that we really love to see in this facility. And part of when we were making decisions on what products and lasers we were going to bring into this facility was based on acne and how to help people in not just a medical standpoint, but in a therapeutic standpoint. Because sometimes, it takes going to the dermatologist and actually getting an oral medication, and then other times the two are married, or sometimes it's just something that we can correct in a therapeutic approach because somebody's having imbalance in the skin. And we always try to do that first, obviously, before any kind of harsh medication. But acne comes in so many different forms, and it could affect any portion of the body. The common faces are obviously the face, the chest, the back, but it can also go beyond that. And what it does is it really kills people's confidence sometimes. So we take a multifaceted approach to acne, and we treat anyone from teen to, I have 75-year-olds that are still experiencing acne. This is not something that is limited to age. There are so many different factors that can make this happen. So the typical acne is caused by an irregulation of bacterium in the skin, and that is the P. acne bacteria. So a lot of people think that they just need to obliterate their skin with medication and overwashing and overtreatment, sun lamps, and you name it. And although the sun and UV light may have a temporary killing of the bacteria, you're damaging it with sun, and you're getting sun damage and aging instead. So we like to look at things from start to finish. We are a medical team, obviously. We have a doctor here that can talk to you about your internal health, so we can figure out maybe some things that are going on internally with your body. And then we go from your at-home care to our in-house treatments, from small things from just using our medical grade skincare and getting you off of all of these TikTok trends that everybody keeps doing. Overuse of product is probably the most common thing that I see when it comes to acne.
Because people want immediate results.
They want immediate results. And when I just had this client come in, one of the interesting things that she didn't know was that it takes at least 60 days for you to see a product work. And the way I broke it down for her was that the skin works in 30-day cycles. Of course, as we age, those cycles get a little bit longer. But the way that your skin is functioning within those 30 days is when you start to see a medication or a treatment work. So typically, before somebody even sees a result with one of these medical grade products, they stop using it because in 5 days, they haven't seen clearance in their skin. So the 30 days of your skin cycle turning over is when it just is starting to work for you within that cycle. After 60 days, you're actually starting to see the medication change the way that that skin is functioning and change the balance of bacteria and pH in the skin. And that is one of the most important things that I can tell acne patients and clients in this place. You need to stick with one thing. The other thing is everybody's using 75 different products. They see these trends on TikTok. They see these influencers who are touting products. You have to realize a lot of these people are making money off of these products. So they don't always have the medical background or the expertise to tell you what you should be using. I've been doing this personally for 17 years. I've seen acne of all different types. And Dr. Kalani's been practicing for how long now?
We're not going to say. 50 years.
So
50 years?
the most important, 50 years. So the most important thing is to come in and have a in-person consultation with us. We want to remove your makeup. We want to look at you. We want to actually see what's going on with the skin and look it over. I also have you bring in all of your products that you might be using, because a lot of over-the-counter products, makeups especially, they're made out of oil, because the way that makeup sticks to the oil-based skin is that it's an oil base. So you're clogging the pores, you're causing lots of irritation. A lot of them have fragrances and dyes and things that just do not belong on your skin. So years ago, Susan and I went through a lot of training and information to create Kalani ND, and sat down with our formulators to have very, very clean and medical-based products. And it's very important to be simple at first. You want to add one thing at a time to your repertoire.
Right, and we worked really hard to keep it very affordable.
Yes.
That
We have a
particular
very
line that
affordable line.
we deal with acne, we know that it's a lot of young people, and we really try to look at the cost factor there
Absolutely.
and keeping it affordable for people.
Because that's also a big limiting factor for people, and sometimes that will drive people into the drugstore. Now, I'm not saying there are no good products in the drugstore, because of course there are some that we also marry that we might not have. But you have to be very careful with that, and you have to be very careful with ingredient lists, and that's something that I am very trained in. But I won't get into the total specifics of the disease itself. It's a little confusing. I just want to talk about some things that we have to offer, and as far as acne treatments go. So, like I said, we go from teens to adults, and the very first place we start again is your at-home product, and we get you on a good simplified regimen at home. And then we go into working with some of our medical grade peels. Now, people hear chemical peel, they get a little bit nervous about that. But what we use is a medical-based product that is derived from salicylic acid. I'm sure you've heard this product many times. It is derived from the bark of a willow tree. It is a very natural product, and it works to balance that bacterium in the skin. So that is something that we start with, and that's a monthly treatment that we go into to get that skin calmed down. And a lot of times, even just that simple treatment and just that simple cleansing married with really good at-home care, gives people a lot of clarity in their skin. The one thing that is separate from acne is people want to they associate blackheads and acne with the same thing. True acne is when you're seeing red, inflamed pustules and papules on the skin. A blackhead tends to really come from lack of cleanliness in the skin. Now, we all get blackheads. Blackheads are just a pore that is exposed to oxygen because your skin is always producing oil. So when that gets oxygenated, you get those little black dots in the nose, and that's not acne. Those are just, your skin's alive, and those are just things that you can see, and there's also ways that we minimize that. Salicylic acid is one of the best ways. True acne, again, is like an imbalance of that bacterium in the skin, and that needs to be treated in a completely different manner. The other issue that I see with people is picking and squeezing of the skin.
Yes. And I think I could say something to that, because we've seen people in the office that they will pick and squeeze, and they'll end up actually rupturing something, and it gets inverted into the face.
Absolutely.
That then later becomes infected.
A cellulitis.
A cellulitis, whatever it may be, and then we actually have to go in and surgically remove that. And that's a whole other ballgame that you really don't want to get into.
And that's where the true scarring acne is actually, we don't see as much of it as people picking and creating these scars for themselves.
Yeah.
There are ways that you can extract the skin. That's something that we do prefer. We do in-house. I'm trained in doing extraction and taking care of those kinds of things. But there are times that these in-house, med spa treatments, I would consider that they don't do the trick. And that's when we get into our heavier treatments like the BBL by Sciton, which has a specific wavelength of their laser that has done amazing things for people. It is a certain wavelength that we use that kills the bacterium very deeply underneath the skin, and then it can also go after the other plaguing part of acne once it's cleared up, which is called post-inflammatory hyperpigmentation. That is the inactive marks that are left on the skin, and that is also one of the most common things that I treat as far as getting rid of the redness that you see that's post-acne breakout. Those are no longer active. A whitehead is your body's defense against that P. acne bacteria. Once that goes away, you're typically left with that post-inflammatory hyperpigmentation. A lot of times that does require laser on a very specific wavelength that goes after the vascularity of that, because that's red blood cells stuck in that area that are trying to protect that skin. So we use a combination of lasers that are in the light-based family to kill bacteria, get rid of the redness, and help with some of the inflammation of that. Then we go into our clear silk, which Sarah, you've had some experience with. And that is a non-invasive YAG laser, 1064, that can help with textural issues. It helps with skin healing, inflammation, and can actually turn around the way that skin cycle is, because sometimes it's also a retention issue where the client may not be exfoliating, and I mean naturally, not on their own. They may not be exfoliating in the way that their skin should, based on internal health and a million other factors. But we believe in a complete combination therapy in this facility, and that's what I think has made us so successful in the treatment of acne. And like I said, if we were teens to it never ends. Acne really never ends, because then there's postmenopausal acne. We've got all kinds of things that happen, and there's a lot of diagnosis. People think they have rosacea as well, which is another thing. It's a different kind of acne, and we do treat all of those different types of
That's
acne.
what mine is, rosacea.
Yeah, you get more of
I get
like a
rosacea.
petechia type. I mean, your skin's beautiful. We take really good care of it. And the one thing I'll say is, don't be embarrassed to come here and talk to us and let me take your makeup off. I've had acne in my life. It's actually when I was 16 years old what kind of got me interested in skincare in the first place, is I had some breakouts, and I know the social effects of that, and we are very sensitive to those social effects because we understand it. So don't ever feel nervous to come in. You and I can meet privately. We'll take your makeup off. We'll go over, or male acne as well. This isn't limited to just females. A lot of men experience acne in just the same way. So we will do a comprehensive look at your skin. We will look over your skincare products. We'll make sure that these are things that are working for you. And we can set a plan for you at really any price point. Susan has been really gracious in making sure, like she said, that these things are affordable. We know that a lot of times it's parents buying these things for teenagers. So we know that you're not spending $150 on a cream for your 16-year-old. Sometimes that's not in the books for people. So we do really have something for everybody, right up until medication, because we have a physician on board who has a lot of experience with acne as well. So if this is something that's plaguing you, a lot of people don't even know that there is a solution. And most of the time, there is a therapeutic solution to your acne, and that is something that we've had a lot of success in this practice.
Wow, I learned a lot. I don't know about you. I thought that was great. Go, Derek. Yes. I think that we all got a good look into acne, and I would like to say that we do understand that. And I really like that you brought that out for anybody that's viewing this, is that we are sensitive to it.
Absolutely.
And not to be insecure about it.
No.
So we know it happens. It happens
We're here
to
to
me
help.
right now. I mean, so that is a great thing. And one of the things that I don't know if anybody has anything else to add about acne. I think you said it all.
I mean,
Got it.
But
just some of the products that
Yeah.
Derek would recommend, and
I actually find that I think that we get tremendous results without even going to the medication.
We do.
Oh, of course.
That's what I
Oh, yeah.
the
Because I
therapeutics.
really think
So
that
much
that
to
is
do.
an amazing asset for anybody that is plagued with this and seeking treatments, is that they might not have to go to a medication.
That has
Right.
side effects and all the different
Oh,
things
right.
that come with that.
Absolutely.
Yeah.
Of course, sometimes antibiotics are necessary. I'm not knocking that in any way, shape, or form. But of course, there's long-term effects to some of those things.
Mhm.
So when people are trying to not go down that route, and we've all heard of Accutane, which again does amazing things for certain patients and clients. I have had people that Accutane really was kind of necessary for them. The skin was in such a bad state that I tried my therapeutic approaches as much as I could. And we're not afraid to send you out of here either. We want the best for you.
Yeah.
So that did become a thing where we actually hooked them up with someone, a local dermatologist, and they wound up needing that kind of treatment. But then I helped with the scarring that was post when they healed from the acne. So we could still marry those things. But most of the time we are able to treat acne on a therapeutic level. So we have very clean and medical grade products. You are getting microionized benzoyl peroxide. These things are really not available in the grocery store because they're not allowed to sell the strength because it's not supervised by a medical professional. So we're not just trying to get you on our product, it's just that we have access to those medical grade products because of our medical facility. So they are more powerful, they are more efficacious, and we do see really phenomenal results with it.
I think that's great. And that being said, one of the things that we do still want to marry with this, and speaking of June, and we're starting the summer, is going into sunscreens.
Yes.
So this is a really important thing,
Huge.
because one of the things with this post-inflammation or the redness that comes post-acne, you really need to keep it away from the sun. You think you want sun, but the sun is going to make those marks more permanent.
Well, yeah, then they can turn brown instead of red. So you do have to be really careful with that. A lot of sunscreens that you find in the store are very chemical laden. There's different things between chemical and physical sunscreens. When you're somebody who suffers from acne, you really should be limiting those types of chemicals. You should be using more of a a medical-based. We use zinc and titanium, so we actually have one of the highest grade zinc blocks that's on the market, and it's medical grade. That does make a difference. These things are actually looked at by administrations, and they are tested to be what they are. A lot of this stuff, like I said, these TikTok trends, these things that people are doing, this stuff comes from many other places. All of our products are made in the United States, and not all of these other places have regulation on these products that you're getting. So you have to be very careful with what you're using on your skin. And the mineralized sunscreens tend to be way less irritating to that already very inflamed skin. So I always try to get people to use at least a mineral-based sunscreen if it's not ours.
Thanks. I think that's we covered a lot. I think,
Come see us.
I
Yeah,
know.
that's the most important part.
I think
Yeah.
before we close, we want to talk about our specials for the month, and I'm going to keep that over to Sarah. But also, because the specials are going to tie in a little bit, we have a celebratory day coming up. June 15th is Father's Day for anybody that hasn't thought about it. So we have to think about that. Father's Day, we celebrate Mother's Day all the time.
Dads like to take care of their wrinkles
They
too.
do.
That's right.
For any men that have acne, I mean,
Absolutely.
comes to do it.
Absolutely.
That's right. So Sarah, I'm going to turn it over to you for specials.
Sure. So to tie in with acne awareness, so right now, like Derek said, the salicylic peel is on special, and you can pair it with the red light and blue light therapy. So I don't know, Derek, if you want to get
Sure.
into that a little bit, but
So,
it's on special right now.
Yeah, we do a red light and a blue light therapy. I'm sure a lot of you have heard these red light and blue light and all these different lights that they do. So we specifically work with red and blue light therapy. So red light therapy is for healing. This is something that was created by NASA to heal astronauts in space because that's how powerful it could be. So it is a diode light that's able to stimulate the skin on a deeper level. So we use red light for the inflammation, and then we use blue light because P. acne bacteria cannot live in blue light. So it actually starts to break down that P. acne and break down that bacteria and balance it within the skin. So that is also, like I said, on the lesser expensive versions of light therapy. That is something you can do, but it's gentle. So it is something that needs to be done on a very regular basis. And of course, if you have any questions about that, that's something that we go over in consultation as well.
So that's the only service special right now. And then as far as the products to go along with acne, we have the blemish correcting serum, which is, these are all of our Clean EMD products. So the blemish correcting serum is great. I use that a lot.
I use that.
And it's gentle.
Very
It
gentle.
doesn't
Very
tear up your
gentle.
skin.
Right. Like you can just do a little spot, or you can
Yep.
even put, all over.
Right, and
So
I have
it's a
very
great-
sensitive skin,
And it
so.
smells
Blemish
wonderful. It smells like tea.
It does, yeah.
Smell that.
So that's on special. All of these are 20% off for this month. The Glycol 5-2 cleanser, which is a really good cleanser, and the Glycol foaming cleanser. So I don't know, Derek, if you wanna.
Sure. So Glycol is one of our products that marries glycolic acid and salicylic acid.
Glycol.
Glycol. So glycolic acid is derived from sugar cane. That is a very small molecule, and what that's able to do is that's what's going in and helping to clean the pore with the blackhead and minimize those pores so that they can function a little bit better. The salicylic acid is something that draws, so that's going to pull the sebum out of that area, and it's going to help to over time slow down that overactive oil production. And one really important thing I want to say, especially with the foaming cleanser, when somebody has oily skin, that's not always a bad thing. That's actually something that very much helps prevent aging in the skin. It makes your skin a lot more tolerant to light therapies, to sun, to everything. So when you over cleanse your skin and when you overwash that oil, your body wants the oil there. So your body's going to keep producing more and more oil to compensate for that. And this is when I talk about the overuse of product. That's why we really like our products. They're low. You hear 5 and 2. These aren't 30% products. It's not necessary when you're regularly using something in the way that you should. The foaming cleanser, the 2-2 cleanser, which is 2% glycolic, 2% salicylic. The foam really makes people feel very clean.
Love the
And
foam cleanser.
the men, I was going to say, the men tend to really love it. And the thing that helps a lot with as well is razor burn, because razor burn it's a bacterium. It's caused by the fact that you've nicked that skin. Now it's exposed to a bacterium, and you're getting razor burn from that. And that leads me into just one other thing with the razor burn is we do laser hair removal for men in this area, which completely eliminates razor burn. Same with the bikini, same with that. That is in the acne family because it's your bacterium's off in those areas. So sometimes our laser hair removal even comes in handy for preventing acne.
Pretty much it. Any other
Any other comments?
comments
No.
or?
Love a foaming cleanser.
Yeah.
I really do.
Barney, I feel that you're so
I
disappointed.
do feel like
I don't know
I'm
how
here.
there was
I
somebody
really
supposed to
do.
be here. I don't know.
It's alright.
Anyway, I think that's a wrap. So we will now, the next month, I think, does that interfere with July 4th? Sarah is double checking, so.
July 4th is Friday. That
So we should be
Yeah.
fine, then
so
we'll
it'll
be on the
July
2nd.
2nd.
You'll see us back in the, oh, I
It's gonna be the
forgot.
following week.
Oh, we'll do it the following week, that's right.
Okay.
European caveman.
Yeah.
They're gonna be on vacation.
Yes.
And so, you're a major part of this conversation. So we have
We
to
need
have
you.
them, yes.
Yeah.
And Ronnie, yes. So we will see you then the second week of July, so that will be that next Wednesday will be the 9th, I'm pretty sure.
Yep.
So I had pretty well.
Yeah, you did. Wow.
Yeah.
And anyway, so if you have any questions, don't hesitate to give us a call. Bye for now.
Bye.